All right, everyone. Welcome to Goat 911 Part 2. We're going to focus on diseases and illnesses. My name is Megan Purdue. I am the agricultural agent in Worcester County, Maryland. This is going to help us hopefully prevent some illnesses and diseases that are common with small ruminants, sheep, goats, alpacas. As always, we do have some disclaimers. Because we're going to be talking about, we might see some products, and we're going to be talking about veterinary stuff. So the advice in this presentation does not represent medical or veterinarian or legal advice. Always seek competent veterinary advice when possible. If we use a product in a picture, it's not an endorsement. That is just what is available in my area or whoever's area that took the picture. You may have different products that are available in your area, or your vet may prescribe different products than what we use as an example. It is essential to have a veterinarian in the event of an emergency. This presentation is only going to cover some of the common problems that may be encountered. Many of the diseases can be prevented with good management, and that's the whole purpose of this, is we want to prevent these. It's good to know how to treat stuff, but it's even better to know how to prevent it. Many of these diseases can be prevented with good management, and many treatments for small ruminants are off-label and require a veterinary client-patient relationship. All right, so why do we need to do this? All right. With small ruminants, remember we talked about last week, they are prey animals. So they don't always show what's wrong with them right away. They might not show that anything's wrong with them, because if they were out in the wild, that would make them more vulnerable to a predator. So recognizing illnesses quickly is usually critical to successful treatment, especially with some illnesses and diseases. Also will make it cheaper, recovery a lot faster the quicker that you recognize it, and take measures to get them better, to heal them. You know your animals best. I mean, as somebody who has worked around small ruminants my whole life, I might be able to come out there and diagnose something, but it's going to take me a while to arrive at that diagnosis. I'm going to have to ask a lot of questions. Same thing with your veterinarian. Going to have to ask a lot of questions versus you who know your animals, what happens to your animals on a day-to-day basis. You might know, oh, that animal must have gotten into some extra feed because they're kind of a bully at the feed trough. So that diarrhea might be caused by too much feed. We want to prevent a lot of this stuff. And there is a lot of good information out on the internet, but there's also a lot of bad information. Facebook is a great example of where you can get some good and bad information. And the more you know, the better you will be able to decipher what's good information, what's bad information. Honestly, some of my presentations are inspired by stuff I read on the internet. But me, as somebody who has worked around small ruminants my whole life, if I'm clueless about what might be happening to my animal, I can go online and start searching, and sometimes that'll give me a clue as to what is wrong with them. One example would be, I had a buck that had a loose tooth, had some symptoms I had never seen before in my life. I did look it up, and somebody said it was on a message board. It had experienced the same thing, same symptoms, went out there, sure enough, it was a loose tooth. So that's one example of what can happen when you do have knowledge. Some purposes and goals: I want you to be aware of common diseases and illnesses that are or can become life-threatening. Again, this presentation doesn't cover everything, especially that a goat can get, because they don't read textbooks, so they like to get into a lot of stuff. Some are worse than others. Recognizing sick and injured animals quickly can give them the best chance at a full recovery. And ultimately, I do want you to build that good veterinary client-patient relationship. This is important so that you can get care for your animals, but it's also important to keep veterinarians working on these animals. The better relationships they have with clients, the more they will want to continue working with them. And then improve the quality of life of your animals. So the first thing I'm going to talk a little bit about is internal parasites. Again, we'll talk about that more next week, but it is important because it's going to be the #1 health problem that you experience in most areas of the U.S. A big one with the barber pole worm, but the symptoms that you may see in if you have an internal parasite problem. The big one's going to be anemia because of the barber pole worm. So you need to check the FAMACHA scores. Again, if you don't know what that is, we're going to go into a little bit more detail of that next week. Sometimes edema comes with that, and I tend to see that now more in sheep than in goats. And it's bottle jaw, and they get it because of how they eat. So if their head is down to the ground and they're grazing, they're going to be more likely to develop bottle jaw versus you feeding them in hay feeders and their head's up all the time. They might not get bottle jaw. Lethargy is a big one. And this might be one of the first things that you notice if you're really paying attention to your animals. In this, some of the first things you may notice is that an animal just lying down more than usual. If I see an animal that's lying down a lot, and everybody else is up grazing, I'm going to go look. If she gets up and she limps, then, we'll figure out why she's limping. But if they're lying down, especially younger animals, then it's time to get your hands on them and get them checked out. Or if they're just lagging behind the others for no reason. Now, if you have a 14-year-old ewe and she's lagging behind everybody else, there's probably, it probably has a legitimate reason. But if it's one of your kids lagging behind everybody else and just not wanting to keep up, then it might be a problem with parasites. Weight loss is another subtle sign of parasites. So if your animals one animal seems to be dropping weight and there's no reason for it, then you need to go ahead and check them for parasites. And sometimes they have a pot belly, especially in some of these younger animals, and people will mistake that, new people that haven't been around animals a whole lot might mistake that for actually being a fat animal. But it's actually a very severely parasitized animal. So just be cautious of that. Some of these parasites bring on diarrhea, and then loss of appetite also can accompany some of these because there's a lot going on. If there's a heavy parasite infestation, that's happening in the gut. So just imagine a lot of activity in your gut's not going to make you feel so great. The causes of internal parasites is going to be ingestion of worm larvae. So the Homunculus contortus is the one that we worry about the most. That's the barber pole worm that causes anemia. What happens with these parasites is the eggs come out into the feces, and then it hatches and they ingest the worm larva off of the grass. Another one is ostratasia, brown stomach worm. That one can cause diarrhea. Tapeworms is probably the one that people see the most and worry about the most, but it's not usually a concern if the animal is otherwise healthy, because you can actually see the white segments in the feces, and that's why people worry more about that, but it's actually probably the one that we should least worry about. For diagnosis, you can send a fecal sample in to have it analyzed, but basically what they're going to tell you is there's eggs in there. They're not going to be able to differentiate between the different types of roundworm eggs in a fecal sample, but it will tell you if there's a lot of eggs in there, or if you're looking at, is this a worm problem, or is this a coccidia problem? So younger animals, sometimes those fecal samples are more important to make sure that you're not missing coccidia. And then looking at the FAMACHA scores is always important to determine whether or not you're going to deworm that animal. If their FAMACHA score, if you look at their eyelids and they're too white, then you're going to go ahead and deworm whether you take that fecal sample or not. So for treatment of internal parasites, you need to deworm with effective anthelmintics. A lot of people use stuff that doesn't work. And they wonder why their animal doesn't get better, or, it just has a chronic problem with it. It's probably killing off a low amount of worms that is allowing it to still live, but it's really not getting a big kill that that animal needs. There is widespread resistance to all classes of dewormers in most areas of the United States. So be aware of what is resistant in your area. You always want to follow integrated parasite management treatment plans. And a good place to get information is wormx.info. And again, we are going to go over this in more detail. And I do recommend that you take a FAMACHA course, integrated parasite management course, if you have the opportunity in your area. When you have a severely parasitized animal, it's always a good idea to separate them and give good quality feed. Especially if they have bottle jaw, really bad bottle jaw, they're not going to be able to compete for feed. It's going to be hard for them to eat, and they need that good quality feed to build back their red blood cells. And then also you can administer supplements. Sometimes mineral supplements and B complex will be helpful. There is a fact sheet on warmex.info called When Deworming is Not Enough. That's a good resource if you have an animal that's severely parasitized and it has trouble getting it back on its feet. Prevention, again, practice integrated parasite management, attend FAMACHA or integrated parasite management trainings. If you are local in this area, they are offered throughout Maryland and Delaware. I will be having one this Friday in my area. These are all-day hands-on training. Some things that we talk about in that is you don't let your animals graze pastures too closely. You want to keep the grass above 6 inches. Because that larva can travel up to about 3 to 4 inches. So if they're grazing right to the ground, that's right where all that larva is. Rotating pastures, keeping your animals in good body condition, minimizing stress. And we only want to treat animals as needed. So we're only going to treat, if I go out there in my goat pen, I'm going to look for the animals that are anemic. Those are the animals I'm going to treat. The ones that are nice and pink, I'm leaving them alone. Site that I see more frequently in my area, just got a call about it this week, as a matter of fact, is the meningeal worm. So if you are in an area where you have white-tailed deer, this is something to be aware of. Alpacas are very, very susceptible to it, to the point where most alpaca breeders are going to be deworming their, which we don't recommend for stomach worms, but they're giving their alpacas ivermectin once a month because of the meningeal worm. The only reason I don't have a problem with that is most barber pole worms are resistant to ivermectin anyways. So like I don't use ivermectin to deworm my animals. So I'm fine with that as a preventative for meningeal worm. But with this one, snails and slugs are intermediate hosts. So if you're in an area that has a lot of moisture, this is something that you should be concerned about. The animals become infected with it when they eat forages that have been contaminated with the mucus trail from snails or slugs. The problem is when it gets into something other than the white-tailed deer, the larvae migrate to the spinal cord. So you get neurologic symptoms with it. So the animal might start stumbling around in the earlier stages of it. They may become ataxic, may look like their hind limbs are weak. Eventually they'll have problems getting up. You might see knuckling. There's usually some paralysis. Usually for most of them, it starts in the hind end. One symptom that you can see that I have not seen is rubbing or itching. And they say that's because the larva, they can like feel the larva in their spinal cord area. So I guess the sensation makes them itch. You may see nystagmus or head tilt if it gets to the brain. So these are all symptoms to be aware of, especially if you have a lot of white-tailed deer close to your farm and you do have that moisture that causes snails and slugs to be active. The diagnosis for this is usually based on symptoms and a history. So again, it's important to know what's going on in your farm. If you're in an area, like I have white-tailed deer right outside my fences. I also have slugs everywhere all the time. So this is something that I'm personally concerned about. And if I see anything with any neurologic symptoms, I'm probably going to start treating for meningeal worm, unless I can definitively say it's something else. So the history is very important when you're diagnosing this. Necropsy is an option if you do find a dead animal, but it can be hard to find that larva on a necropsy. So it's not necessarily going to give you any definitive answers. For treatment, ivermectin is used for more of a prevention. It is not effective once the larvae have reached the spinal cord. Fenbendazole is what the recommended drug of choice for treating it, especially once symptoms develop, because it can cross that blood-brain barrier. For this, you do need to consult with a veterinarian because you're going to be using this off-label. You can get fenbendazole for goats, but you're not going to be using it according to label at all because you're using very high doses of it. So you do need to consult with your veterinarian. Other things that are very important for it would be NSAIDs or steroids. That can make a big difference because the sooner you get these animals back up on their feet, the better chance they have at recovery. Because if they're laid down too long and they're not using their hind end, then some of that damage may end up being permanent. So the sooner you get them up and going, the better. The fenbendazole is going to kill the parasite, but those steroids or NSAIDs are going to help to get to relieve those symptoms and get the animals up. They can move, they can eat again, they can get to water, and they can utilize their muscles. Another important one that we touched on a little bit earlier is coccidiosis. Coccidiosis is caused by a protozoa. It is species specific. The symptoms of this are going to be, usually the main one's going to be diarrhea. It may have blood present. You can see some anemia with this. So that's where a fecal might be good for you if you're seeing some anemic animals, but you're also seeing diarrhea. That, especially if it's younger animals, I'd probably say go ahead and get a fecal. You may have to start treatment of parasites ahead of that, but at least you want to know whether or not you're dealing with coccidia or parasites, because those are going to be two completely different drugs to treat it. Usually you're going to see weight loss with this, reduced feed intake, or even full anorexia. And then death is a symptom of this as well. For diagnosis, you do need to have a fecal, and it affects younger animals more so than older animals, especially if they're under stress. So weaning time is a time that you need to be watching out for this. For treatment, again, these drugs are off-label, so you need to consult with your veterinarian. They're going to prescribe most of the time a sulfa drug or amprolium. Supportive care might be necessary to treat the symptoms and side effects of the treatment. So there are some treatments that could give you could result in polio for the animal. So it's just something to be aware of. It's not very common, but it is something that you do need to be aware of if you're giving that drug. For prevention, you can use coccidiostats. Again, you want to work with your veterinarian on the type of prevention that's going to work for you. Medicated feeds are available. This may or may not work depending on the setup you have and how much your animals are eating, how much grain they're eating. Reduce stress on young animals. Use low stress weaning methods. Keep your feed clean. Don't feed on the ground. Keep feed troughs and water clean. Another important thing for prevention is not overcrowding, and make sure you have clean barns and housing. You want to be especially vigilant if you do have an outbreak of it to make sure everything gets cleaned. Along that same vein, diarrhea. I'm talking about diarrhea separately because there are so many things that can cause diarrhea, and it is something you are likely to experience at some point when you own small ruminants. But keep in mind that diarrhea is a symptom. So if an animal has diarrhea, it needs to be monitored closely, and you need to find the cause of the diarrhea so you can treat the cause. A lot of people will throw anti-diarrheals at an animal with diarrhea. That might help them from getting dehydrated, but it's not necessarily going to treat the cause of it. So some of the causes for diarrhea is a change in diet, stress, bacteria, and parasites. For treatment, again, you want to make sure that you're treating the cause, but some other things that can help support the animal would be probiotics so that you get good bacteria in the gut. Baking soda, if it's a situation where you might have some acidosis. Kale and pectin, that's an anti-diarrheal. So again, that's not going to treat the cause of the diarrhea. And then in some situations, fluids might be necessary, whether they're oral through electrolytes or IV fluids. Prevention, you want to avoid sudden feed changes and overfeeding. Administer recommended vaccines for your animals, and give probiotics before and during periods of stress or feed changes. If you know something, if you're going to a show, get them started on some probiotics ahead of time, and maybe you won't end up with some stress called diarrhea. Pneumonia is another important one. This used to be the main, before we had a lot of parasite resistance to dewormers. Pneumonia used to be the one that we worried about in my area because of our weather. And we're a very humid area. The weather changes all the time. So it can get very drafty. So pneumonia was always a big concern for my family when we were growing up. Since then, parasites have become the bigger issue, and that's pretty much for everybody. But the symptoms of pneumonia are going to be fever, coughing, labored breathing, and you'll usually see a nasal discharge. lethargy, which usually comes along with a fever, poor appetite usually comes along with a fever, and death. There's several causes of pneumonia. It can be bacterial. It can be a secondary infection from parasites and previous infections that make them more susceptible. Environmental conditions can cause it, like overcrowding, poor sanitation, inadequate housing, ventilation problems, weather changes, and they could also get it from stress from shipping. For diagnosis, you're usually going to go off of the symptoms. You can culture for it. You can also, if you find a dead animal, they can necropsy. The treatments are going to be antibiotics and supportive care. So you do want to consult with your veterinarian. We don't really have a choice now for most of us, unless your vet has prescribed you antibiotics to keep on hand. But you do want to consult, even if you have something on hand, you do want to consult with your veterinarian to make sure it's going to be effective and see what dose and duration they recommend. Supportive care can be fluids, probiotics, and NSAIDs. For prevention, good nutrition, you want adequate and clean housing, proper ventilation, and reduce stress, especially when shipping. I shipped a show goat 6 hours. I went and picked her up. It was 6 hours for me to drive, get there, and 6 hours on the way back. At the end of October, cool weather. It was kind of rainy that day. I feel strongly about reducing stress while shipping, so I turned the back seat of my truck into a stall for her, and we bonded on a 6-hour drive home. But she maintained her pregnancy because I bought her bread, and she never got sick. And vaccination is an option if you have a lot of problems with this. That is a situation where I would definitely recommend consulting with a veterinarian or a small ruminant extension specialist if you need to go that route. And another very important one, and it becomes more and more important, possibly either because of the amount of people buying pet wethers, or that people talk about this or getting it diagnosed more often, but we're seeing it a lot more, is urinary calculi, especially in goats. The symptom of this one's going to be, the main one's going to be difficulty urinating. That can be hard to detect if you don't know what you're looking for. This is most common in males, especially wethers. It can happen in females, but they can develop the urinary calculi, but they have a shorter urethra and there's no twists and turns in it like there's the male. So those crystals are able to pass through the urine a lot easier than it would with the male. So you probably have to have a very extreme case in order to see this in a female. But because of the anatomy of the male, it makes it more common in them, especially wethers if they're castrated earlier. And what happens is you're going to see, if you look closely, the animal is producing little or no urine. Usually they are in pain. They may or may not cry out while they're trying to urinate. And if you've been around males, you know that they stand like they would if you had them in a show, set up like you would in a show. So, sometimes you look out there, are they peeing or are they just standing like that? So if you see your male standing what we call set up in the show world, a lot, then you might want to check to make sure that see whether or not he's trying to urinate. They are going to strain most of the time. And what a lot of people mistake this for is constipation. So if you call me and say, my goat is constipated or my sheep is constipated, I'm probably going to ask you first, is it a male? And second, how old it is. And most of the time, these are happening in older kids and adults. Those animals don't get constipated. You figure they're on a vegetarian diet, they high fiber diet, they don't get constipated. A bottle kid might get constipated, but an adult shouldn't be constipated. So my next question to you will be, have you seen him pee? But again, a lot of people mistake this for constipation. They see the straining. If you look closely, you might find bloody urine around the sheath. And then if you put them on their rump and you extrude their penis, you may see that the urethral process is either white or black. The urethral process is on the end of the penis. If that blood flow is blocked, then the tissue might turn black because it's dead. Another thing that you might find is just a dead goat. If you're a dead sheep, if you don't recognize this in time. It's important with this to recognize the cause of it, and that's nutrition. So we see it a lot in high grain diets. When there's an imbalance of calcium to phosphorus. Inadequate water intake is another contributing factor to it. Other risk factors may be early castration or genetics. If you have an animal, if you have multiple animals having this, and they share genetics, then that might be something to look into. For diagnosis, you can diagnose this by the symptoms and a physical exam. You can do the physical exam yourself. X-rays are important to see how bad the animal is blocked. And then if you find a dead animal, it can be necropsy to see if that was the cause of it. Treatment is you need to call the vet. If you want to save this animal, you need to call the vet as early as possible. The obstruction needs to be relieved because the bladder can burst if it's not. And if they're blocked for long periods of time, the kidneys can be damaged. It's important to manage the pain because this is extremely painful. IV fluids, a urinary catheter is usually the go-to treatment for them. Surgery is also an option, and ammonium chloride to try to dissolve the crystals. This can be a very, very expensive treatment. So you may have to decide how much you're willing to invest in your animal, how important that animal is to you, but you do not want to leave that animal in pain. No matter what you decide, you do not want to leave them in pain because this is extremely painful. So to prevent this, you want to feed high forage diets. This causes the phosphorus to be more likely to be excreted in the feces instead of in the urine. Make sure that your feed is balanced goat feed. So the calcium to phosphorus should be around 2 to 1. A lot of goat feeds already have ammonium chloride in them. And it's important not to add treats to your feed. I have seen situations where people were feeding a very good quality goat feed, but then they added oats to it when they just threw off the whole balance of their feed. So be aware that any other food that you add into that might throw off your calcium to phosphorus balance. You want to provide plenty of clean water. Make sure that it is fresh and not frozen during the winter. You can use salt to encourage water intake. Delayed castration is something that may allow the urethra to grow larger due to the presence of testosterone. But if you delay castration, then it will probably need to be done by a veterinarian. And then culling is also an option. You don't want to breed animals that have a history of producing offspring that have this problem. I've seen enough of it that we actually did write a fact sheet about it, which got published, I guess, the end of last year. It can be found on our website. So whether you are new to raising them or if you are raising, especially goats, and you are selling wethers as pets, it wouldn't be a bad idea to go ahead and print this out and give it to the new owners, especially if they do not know a whole lot. They're new to raising goats. Because I think a lot of people are thinking you can raise them like you do your dogs. You go to the farm store, you buy a bag of goat chow, and that's what they eat. But especially with wethers, they don't need a whole lot of grain, especially once they're grown. They shouldn't really need any, but that forage is a very important part of their diet. Another one that you may encounter, because it's kind of a weird problem, is polio. The symptoms are neurologic with polio. And the best way that I can describe an animal with polio is the lights are on, but nobody's home. Because they act weird, maybe like in a state of a seizure, but not thrashing. You might see them thrashing. Sometimes you're going to see twitching. Nystagmus is a very important symptom. So my first experience with it, my mom told me my goat had been hit in the head. And when I got home, he was literally rolling around on the ground. And when I grabbed his face, I could see the nystagmus in his eyes. And if you're not familiar with nystagmus, when their eyes start darting back and forth. So it can be hard to see. You have to hold the animal still and you have to look at their eyes and see if their eyes are darting back and forth. That's nystagmus. They probably feel very, very dizzy. That's why you see the staggering, you might see the thrashing. So they're not walking like they should, and they might look like they're having seizures. Death can happen with these if it's left untreated. The diagnosis is based on those symptoms, and then an important part of that diagnosis is a response to treatment. So once you start treatment, you should start seeing some positive results within 30 minutes to an hour. The cause of polio is insufficient thiamine. So excessive, if there's a lot of sulfur in the diet, excessive sulfur is an antagonist of thiamine. So, if you're seeing this a lot, I would start looking for antagonists in their diet on the farm. What happens is the microbes in the rumen aren't producing enough thiamine. This can happen with digestive upset. So if they ate too much grain, they get diarrhea. This could come along with it. Parasites can cause it, a high parasite load. The animal's been off feed. They've had a disease, either a fever, so a high temperature, or a low body temperature. The microbes will die off and can cause polio. And certain medications can also cause polio. So the treatment is easy if you have what you need. So you want to supplement with thiamine or B complex several times a day, because B complex has it in them, several times a day until the problem is resolved. You want that to be injectable. So usually they recommend the first thing is going to be an intramuscular injection to get it into their system very quickly. And it is like a miracle. You see them, and then all of a sudden they're starting to act more like themselves within 30 minutes to an hour. But you have to do that several times until those microbes can start producing the thiamine again. One thing that may cause you a permanent problem and cause you to have a dead animal is if there's a complete die-off of the microbes. So if they've had a fever for a long time, or they've had a low body temperature for a long time. In this case, your only option is to restart the rumen. So getting cud from a healthy animal, that cud would have to be kept at the proper temperature until you can drench the sick animal with it. That sometimes works, sometimes doesn't work. And then treating the cause. If you find there is a cause, a certain disease or something, medication, stopping the medication. So you always want to treat the cause of it. Something that kind of goes along with polio is listeriosis, or it's called circling disease. The goat in the picture is actually the inspiration behind this whole program, because she contracted listeriosis from eating moldy hay. Free hay was given to the neighbors. They decided to, be nice and give it to the other neighbors. That goat got listeriosis. Some of their goats also died, and they didn't know what from. Most likely their goats had listeriosis as well, if this one did. The symptoms of this is there's encephalitis, and it's called circling disease because they tend to walk in circles. And it's only like one direction. So this goat, they had it in a mudroom, and if you weren't holding the goat was just walking the perimeter of the mudroom constantly. You're going to see some salivation usually, depression, decreased appetite. Fever usually comes along with this, but in this situation, that goat actually had a low body temperature. Her temperature was too low. They can get facial paralysis. They will become laterally recumbent, what she did, eventually leading to seizures and death. What actually killed this goat was because of her low body temperature, she also got polio. We actually did a rumen transfer from a fistulated cow. It worked for a couple of days, and then the microbes died off again, and it just became too much. She ended up being put down. The diagnosis is based on symptoms. It is very similar and often confused with polio, but it can cause polio. So a lot of times you're going to treat for both. The causes is they're ingesting the Listeria bacteria. This can come in usually comes in spoiled hay or feed, contamination of the feed, because this bacteria is shed in feces. For treatment, the prognosis for this is not good. In fact, when I had started treatment on this goat, I'd even put in an IV catheter. We did fluids. She responded to the fluids very positively, started eating again, and then just kept going. She would go downhill. She'd get better, then she'd get worse. When they contacted the vet called me, and she asked me what I did, and she's like, you did everything correct for her. And she's like, they usually don't survive. So this one has a very poor prognosis. I would never tell anybody not to treat it, because sometimes with some of these ones with poor diagnosis, depends on the animal, how early you recognize the disease and start treatment. There's a lot of factors in play. So you could be one of the lucky ones that it works for, that the treatment works for. But either way, if you encounter this and you want to save the animal's life, you need to contact the vet immediately and start aggressive and early treatment for it. High doses of penicillin, they could be complex with it. Fluid therapy, I think, would make a huge difference because you're flushing out. You want to flush that animal out. You want to keep them well hydrated. Cud transfer if the animal does develop polio. The treatment and recovery period for this is 2 to 3 weeks. Again, no guarantee of success. And if it went on for a while, the animal may have permanent damage. For prevention, don't feed spoiled or moldy grains. Make sure that your feed is good quality, your hay is good quality, there's no mold in it. One thing that kind of irritates me is people will advertise goat or cow hay. If they're a round bale stored outside, they've been weathered, they may have mold in them, that is not okay for a goat. A cow has a much larger digestive tract and can tolerate that. Goats cannot. So I do not. Now, if it's considered goat hay because it's got some weeds in it, fine. But if it's because it's been stored, it hasn't been stored inside, that's not adequate for a goat. Don't feed grain or hay that's been contaminated with feces. Keep your feed and hay feeders off the ground and your feeders clean. And for some of these diseases, you're going to see public links to publications where there'll be more information, and this is one of those. Another thing that you may encounter, and again, we have a lot of these in my area, is poisonous plants. We're very good at growing really bad weeds and really obnoxious weeds. So we also grow poisonous plants too. So the problem with poisonous plants is sometimes the first thing you're going to see is death, depending on the plant. Some plants may cause shortness of breath. Some may cause organ failure, whether it's the heart, kidneys, or liver. They can cause muscle tremors. Some cause photosensitization, where they're sensitive to light. Some cause seizures, and some cause vomiting. When somebody tells me that their small ruminant is vomiting, a lot of alarms go off, and hopefully it's because they've mistaken it for something else and they're not truly vomiting. But if they're truly vomiting, that is a really, really bad sign. Some of the common culprits, and again, this is not a complete list. There's so many of them, and there might be some that we don't know are poisonous yet. But stone fruit trees are one. You hear a lot about cherry trees. And when that leaves, especially after a storm, you get leaves that blow off, they wilt. That's when they're poisonous. You might hear people say, "Oh, mine eat on cherry trees all the time and don't have a problem." That's because they're browsing fresh leaves. They're not browsing wilted leaves. Usually the problem comes after a storm when, there's been a lot of wind or a branch is broken. The nightshades are poisonous. Milkweed is poisonous. Dogbane, these two get confused a lot of times because dogbane has become very prevalent in my area. But they're in the same family. They look similar, but they're both something that you wouldn't want out in your pasture. The red maple is considered poisonous. Hemlocks, pokeweeds, buttercups are considered poisonous. But with some of these, it's how much they are eating and what other stuff they're eating, which can cause them to have problems with them. So like buttercups is considered poisonous, yet you might see sheep out there grazing them, but they're not grazing 100% buttercups. Now somebody that has only buttercups in their pasture and they're not providing hay, there's no other grass under the buttercups, they might have a problem with them. Rhododendrons are poisonous. Johnson grass in certain stages is poisonous. A lot of ornamental plants can be poisonous. For treatment, you want to contact a veterinarian immediately. They might tell you to do some stuff at home, like administer activated charcoal and then bring the animal in for more treatment. Again, with these plants, the toxicity is going to depend on the time of year, the condition of the plant eating, whether it's wilted, been stressed, after a frost, stuff like that, and or the quantity that it ate. If it eats one leaf and has been grazing all day with healthy plants, then it may never have a problem with them. There's a lot of factors that come into play when it comes to poisonous plants. For prevention, it's great to eliminate these from from any area the goat has access to. So, you know, if there's wild cherry trees around, maybe cut them down. A good way to prevent these would be improving the fertility in your pastures, renovating your pastures. So planting good grasses in there, putting the nutrients out there, because good grasses, when you renovate a pasture and you put good grasses out there and you amend the soils, you put the nutrients out there, they can outcompete some of these weeds. And then if a weed does get out in your pasture that's poisonous, well, hopefully it's one that is dependent on the quantity eaten. So if they have a whole belly full of good grasses and they eat a little bit of something that's not good, then hopefully it will not affect them. One saying that a colleague of mine has is dilution's the solution for pollution. So I always tell people, you know, make sure you get it diluted out. If you have them, make sure it's diluted out. Keeping your animals well fed. So if good pasture is not available, keep hay available for them so that they're not starving when they go out there trying to browse through the pastures. Never turn hungry animals onto a new pasture or browsing areas, because they're not going to be as selective in what they eat. So they might eat anything and everything that's available to them. And if that's poisonous, it's not going to end well. Another one that is a preventable disease through vaccination is enterotoxemia, or overeating disease. The symptoms of this one is usually going to be diarrhea, which may be bloody. Not eating, they're usually in a lot of pain. It's abdominal pain. They're in a lot of pain. They become laterally recumbent. So if you don't know what that is, that's laying flat out with their legs extended, head and neck over their back. So what you would how you would expect to find them dead. And then death can be very sudden and can be preceded with convulsions or seizures. So what happens with this is there's a rapid increase of the Clostridium perfringens type C and D that's found in the intestines, and that's what ends up causing the disease. So stuff that can bring on that rapid increase would be a change in diet, an increase in the amount of feed or milk if it's a baby. And when there's a rapid increase in it, the bacteria release toxins that damage the organs and cause the animal to start becoming symptomatic. Young animals are the ones that are most at risk for this. So for treatment, you want to get a veterinarian involved immediately. You administer C&D antitoxin, which can be hard to locate if you don't have it on hand. The problem with having it on hand is it's kind of expensive, and it doesn't last forever. And hopefully you will rarely use it. In my experience, a lot of vets don't keep this on hand either, because it's something they rarely have to use, either because people don't have a problem with it or they recognize it too late and the animal is too late for treatment. Usually they're going to give antibiotics, give probiotics, IV fluids, antacids, pain medication, and thiamine. It's an easy thing to prevent. Make sure that your animals are being vaccinated properly. So generally we're going to give for vaccination, we give Clostridium perfringens type C and D toxoid. So the antitoxin is what you would give a sick animal. The toxoid is the vaccination to prevent it. You can also use CD&T vaccine, which will have the tetanus in it as well. The initial vaccination is going to be 2 doses, 3 to 4 weeks apart. And then you give an annual booster, and we recommend that being given around a month prior to kidding or lambing. You may have to booster more than once a year on some farms if you have a big problem with it. If that is the case, then you are no longer using it according to label, and you need to have a veterinarian involved in that decision. There are the vaccines that you use for goats should be labeled for goats, because this vaccine is available already labeled for goats. So if you pick up one that's labeled for sheep and cattle and not for goats, then you need to go find one that's labeled for goats. You can use the one that's labeled for sheep on your sheep, or on your one label for cows on your cows. These vaccines tend to leave knots for an extended period of time. So keep that in mind. You want to vaccinate an area that's not going to get rubbed up against too much and get broken open. You don't want to vaccinate somewhere where it might be mistaken for CL. And people think you have CL because they see knots on your goats or your sheep. Avoid abrupt feed changes, and when you have bottle babies, don't overfeed them. Along with this is tetanus or lockjaw. This vaccination can be given with the C&D vaccine. With this, the muscles become very rigid, they become very stiff. The third eyelid will partially close when the animal is startled. They may have difficulty swallowing, and they may develop a sawhorse stance. So they'll look like they're standing kind of like a sawhorse. If you're familiar with a sawhorse, they might just stand there very rigidly like that. They develop an inability to breathe. There's a lot of pain associated with this, and then it can progress to seizures and death. This is caused by another Clostridium, but the Clostridium tetani bacteria. Usually they get it through deep puncture wounds. They can also get it through castration or broken skin. For treatment, again, you need to get a veterinarian involved right away. Tetanus antitoxin is administered, and that is a little easier to get your hands on as long as there's not been a shortage of it. They keep a lot of it on hand because they use it a lot for equines. They'll administer antibiotics, also sedatives and pain medications, and then supportive care. For prevention, you want to make sure that you vaccinate against it. And again, you're going to use a toxoid, a tetanus toxoid. You can give the same vaccine for the Clostridium type C and D and the tetanus, as long as you get a vaccine labeled for all three. So C, we call that C, D, and T. Those are also in some other vaccines, but this is the minimum vaccination that we do recommend for small ruminants, is a C, D, and T. And make sure that when you're reading the label that it does include tetanus if you want to do just one vaccination. Like with all C, D, and T vaccines, the initial vaccination is 2 doses, 3 to 4 weeks apart, with the annual booster, preferably 1 month prior to lambing and kidding. Again, if you have a lot of problems with this, talk to your veterinarian if you're going to use it off label, and make sure that the vaccine is labeled for goats if you are vaccinating goats with it. You can administer tetanus antitoxin to unvaccinated animals prior to castration, disbudding, anything that's going to break open the skin. Antitoxin gives them immediate protection versus toxoids that have to build up in the system to get to a maximum level of protection. Usually that takes weeks to do. So if you're going to castrate a kid from an unvaccinated mother, so you're castrating a kid that's too young to have been vaccinated and allowed that immunity build up, and his mom wasn't properly vaccinated, so she didn't pass on protection to the kid, then that's a situation where you would use tetanus antitoxin to provide that immediate protection against the bacteria. And then keep wounds clean. If an animal gets a wound, make sure that those are kept clean. Another thing, because they are small ruminants and they have a rumen you may encounter at some point, is bloat. Symptoms of that is going to be distended rumen. And this can be hard to pick up on. Fortunately for me, people are usually suspecting bloat and the animal's fine. If it got into, a lot of times once it gets to the point where most people recognize it, it's pretty far advanced. But the symptom is going to be looking for that distended rumen on one side. One side will be bigger than the other side. One way to differentiate that from a full rumen, because usually a nice full rumen, people are like, I think my goat has bloat. And what I ask them is, how is the goat acting, or how is the lamb acting? So the easy way to tell if it's okay is to offer it some feed. If you offer it a little, you don't offer it too much because it's already full. But if you offer it a couple pieces of grain and it eats it right up, probably it's okay. Because if they have bloat, they're going to be in some pain. The last thing they're going to want to do is eat. But if they're running around acting normal and they have a good appetite, then they're probably okay. They're just full. And usually that'll go away pretty quickly. Difficulty breathing can come along with this. So you're looking for short, quick breaths. But also the first thing you may notice is a dead animal, because this can progress fairly quickly. So if it's something that happens overnight, you might not catch it. It's caused by a buildup of gas in the rumen. So this can happen because of a change in feed, too much feed, or you've put them on legumes, let them eat too many legumes, or started them on legumes too abruptly. For treatment, get a veterinarian involved immediately. Administer bloat release. The problem with bloat release is that you may need a stomach tube to get it into them. And then a trocar can also be used to relieve the gas in the rumen. The best thing to do is prevent it. Good feeding management. Don't overfeed. Don't introduce large amounts of legumes to an animal that's not used to them. And don't turn hungry animals onto a pasture with a lot of legumes. And then I referenced this a little bit earlier when I talked about people mistaking something for vomiting. I just put it in quotes because different people are going to call it different things. But here I'm just calling it choke. Because it's not, and I put it in quotes, it's not a real choke. It could kill the animal if it gets worse. But usually in my experience, they're able to get it up. So this is when the symptoms you're going to see with this is coughing, and it's going to happen at feeding time. So coughing, they look like they're choking. You're going to see a lot of foam around their mouth. And then people say that they're vomiting because what's happened is the feed has gotten stuck in their esophagus and they're coughing it up. So the feed that they just chewed up is coming back out. And it happens when they eat their grain too fast. So for this one with treatment, you want to watch them to make sure that they are getting the feed up. You might see them, when this happens, I see them like jump and stomp the ground. It kind of looks like they're trying to give themselves the Heimlich. But you trying to do it for them doesn't work. First time I saw it, it was scary. But usually they do get it up on their own. If it becomes too severe and it's too blocked, then you may need a veterinarian to come in and try to tube them to relieve that blockage. So if you have an animal that's doing this, there's some things that you can do to try to prevent it because the same animals seem to do this all the time. So you can spread out their feed so they can't gulp large amounts of their feed. If you're feeding a pelleted feed, you can try to moisten the pellets and see if that'll help. Feeding multiple times a day can help them not gobbling the feed too much. And then what might be causing the problem is you have aggressive and timid animals in the same pen. The aggressive animals are blocking the timid animals from the feed trough. So the timid animals, when they do get up there, they bolt a bunch of feed down, trying to get the feed as quickly as possible. So if you can separate them, that may help. So when you're looking for information, you want to make sure for any diseases or illnesses or treatments, you want to make sure that you're getting reliable sources of information. So I work out of a county extension office. You should have a county extension office no matter where you are in the US. You should have access to that. There is extension services in every state. These are tied to land-grant universities. And so if you have an agent in your county that knows nothing about small ruminants, they should be able to connect you with someone who does. And hopefully a lot of states have small ruminant specialists or sheep and goat specialists that can help you out. Some states may have just ruminant specialists, but they should know a good bit about small ruminants as well. So reach out to your county extension offices if you need training or you need more information. When you are looking through websites, you want to look for that .edu when you're coming up with fact sheets and stuff like that, because those are tied to universities. So the information at a land-grant university should be research-based. So you can get fact sheets, bulletins, much like the fact sheet on urinary calculi. And then the small ruminant consortiums are good places to get information. Those members are research and extension faculty from universities. And of course, your large animal veterinarian is a good source of information. When in doubt, call your vet. A lot of people are very timid to call their vet. And I hope that these presentations give you the confidence to make that call to the vet and not worry, well, am I bothering the vet? Is this not an emergency? I want to make you confident because I worked at a vet's office for a long time and I didn't mind the ones that were not emergencies. What we did mind was those that were emergencies, but should have called us 2 days ago. We didn't mind telling you, oh, you're good. I'd rather do that than get the call a couple of days too late. And sometimes peace of mind does have a price on it. It is worth that visit to the vet for the peace of mind. So a little bit about medications that it's important to remember, especially with small ruminants, is most of the available effective medications and dewormers are not labeled for goats especially. There's more labeled for sheep. Some might not be labeled for sheep either, but especially for goats, there's a lot that aren't labeled. If you use these items on an animal it is not labeled for, it's considered off-label. It is illegal to use medications, be it antibiotics, anti-inflammatories, dewormers, etc., off-label unless under the direction of a veterinarian. A valid veterinary client-patient relationship, VCPR, is necessary for a veterinarian to give medical advice. Do not be offended if you call up a large animal vet and they refuse to talk to you because you are not a client. They cannot give you medical advice over the phone if they've never seen your animals, never seen your operation, never even seen you. They cannot give you that information. Veterinarians can give guidance on withdrawal periods, and that is an important thing when we're talking about food producing animals and giving them medications that are not labeled for them. And then veterinarians have access to information that's unavailable to the general public, and they can share information amongst themselves. So I was talking about listeriosis and how the prognosis is bad. The first people who are going to know of an effective treatment for that are going to be vets, because they can share that. They can say that I used this protocol and it worked. And other veterinarians can access that. The general public can't, but they can. And then as always, if you have any questions, you are welcome to contact myself. Susan Shanian was our sheep and goat specialist. She is retired, but she is now in emeritus status. So she does still respond to some questions. Email is a great way to get a hold of us, because sometimes I have a regular office, but I might not be in my office from day to day. Just depends on what I have going on, but I do check my email every day. Whether I'm working or not, I do check my email. So you can usually always reach me by email. And if you are not in Maryland, but you don't know who to call, you can always contact one of us, and we should be able to connect you with someone locally. So just let us know the county and the state that you're in, and we might be able to connect you with somebody in your region or even in your county.